At the end of the day, this has impacted so many people, so many families, and lives were lost. And so if someone dropped the ball from the federal level and it dwindled down to the city level and local level because we were trying to access information and resources, someone needs to be held accountable.
We have in this city, of course, experienced firsthand how different the experience of this pandemic has been for African Americans. I don't think anybody who lives here has been spared that really personal experience with this, and just how dramatically different it is for people in other places. There's a lot of talk about why that's true and what to do about it. You think that it's time to take an extraordinary step, inviting the Department of Justice in to try to figure out if there's wrongdoing at the bottom of this. To talk to me about that decision.
Well, I think what we're seeing in Detroit is not unique to just Detroit. We're seeing this in urban communities across the country where Black and Brown residents reside. And we're seeing a higher rate, a disproportionate rate of African Americans who are being infected and unfortunately losing their lives to COVID-19. And so we believe, and it's not just me, it's a number of elected officials that represent these cities, believe that we should have a thorough investigation from the Department of Justice come in to look to see from a local, state, and federal level how executives actually responded to this crisis. And if they did so in a way that further exacerbated some of the disparities that we currently see. And so we know, we've read in several reports that individuals were trying to get tested and were denied in some cases. And this again is not just unique in Detroit. This is happening everywhere. And so we believe that there could be cases where there was civil rights violations, and we believe that the Department of Justice should come in and do a thorough investigation and look at the response in which different cities responded to COVID-19.
Yeah. In the release about this, you talk about not only things like testing, but the sharing of information.
Yes.
I think is really interesting because we had tremendous problems here in the city, I think, with people really getting info that they needed before it was too late. But the idea that was perhaps criminal, which doesn't necessarily mean intentional, right? I mean, there is such a thing as criminal negligence as well. Again, I think is another really, really dramatic step forward.
No, I agree. And my thing is, at the end of the day, this has impacted so many people, so many families, and lives were lost. And so if someone dropped the ball from the federal level and it dwindled down to the city level and local level because we were trying to access information and resources, someone needs to be held accountable. And there is no question and no doubt that the African American community has been disproportionately impacted by this virus. And we understand that the virus doesn't discriminate, but policies can, and they do discriminate. And we want to not just know this information, but to get some answers. We also know that there can be possibly a second round of this virus. And we want to make sure that this is handled appropriately and at a rate in which people are getting tested and information at the speed in which that can actually save people's lives. So this is very important to each and every one of us. We don't believe that underlying conditions are the sole cause of the reason in which African Americans have been disproportionately impacted by COVID-19. We believe that it plays a part in it, but could the executive branch of government, government in general have responded at a better rate to help prevent some of what we're seeing? We don't know. And we believe that the Department of Justice should look very, very thoroughly at the way in which government has responded. And then again, also look to make sure that, there's been no civil rights violations as it relates to access to testing, personal protection equipment, and the list goes on and on.
Yeah. I imagine that there are some people who will look at this and say, well, this is just casting the blame away from local officials, and that it's local officials who failed people in these cities. How do you answer that?
Well, actually, the request is a request that the Department of Justice look at the local, state, and federal executives on all levels. So we're not just pointing the finger at the executive branch. We want to look at city, state, and federal. And not to say that we're, pointing the finger at anyone here in Detroit. Again, this is a national crisis and a national problem, and we believe it should be looked at in each city to see what went wrong or what we can improve on. And so this is not just pointing the finger to the federal level. We believe that every branch of government, every level should be looked at very, very closely.
Yeah. Talk about, from the standpoint of the city council, how you feel we've done since all of this happened here in the city of Detroit. I mean, we were caught flat-footed. There's no question about that. I think most cities were. But we've seen a really different response over the last 7 or 8 weeks. Give yourselves in the administration here some assessment of how we did.
I have to be honest, when I was on the call with elected officials from around the country and I was hearing some of what they are experiencing, I was quite pleased at the response in some of the testing efforts and the PPE equipment that we're getting to our first responders and essential workers and some of the policies that we have in place. So I am pretty pleased at what we're doing and the progress that we made. I think the issue is the initial onset of this virus. And in cities everywhere scrambling, trying to provide testing and equipment is really my concern. But again, comparing Detroit to other cities, I will say that I am pleased at the city's response and our commitment to our city employees, our workers, making sure that they have, testing and equipment. But again, I think that, moving forward, there's definitely room for improvement, and we can definitely learn and make sure that we are ensuring that we are responding to this virus at the speed in which we need to save lives.
Yeah, I think the real concern from a policy level is on the future. This is something that I hesitate to even say, for fear of jinxing it, that we seem to at least have gotten a better handle on infections and deaths. I'm really worried about the fall. I'm really worried about what happens next year. And from a policy level, there are a lot of things that we probably ought to be thinking about changing to make sure we do it differently if there's another wave of this disease.
I agree. I agree wholeheartedly. And in fact, I think about water affordability as one of them. Before this crisis took place, I was one of the council members that fought extremely hard to try to get, water cut back on for low-income residents. And then in the midst of the crisis, and it's good for residents who have been struggling, we were able to get a restoration program going. We also talk about moratoriums on foreclosures, rent assistance. All of these things are going to be needed from a sustainability standpoint, something that's going to have to be in place long term to address some of the issues that this virus is going to bring. So I think from a policy standpoint, my concern is how do we get some of these policies in place to remain after this crisis is gone. Like you mentioned, because water affordability is going to still be an issue, and if people can't wash their hands and we get rid of the restoration program, we'll be in the same situation again where individuals could possibly be spreading this virus. So from a policy standpoint, definitely looking at how we can sustain some of what's currently in place temporarily.
And the water question, I don't think anybody really thought it was a great idea to be shutting people's water off. Everybody said when we went back to that, this is exactly the thing you have to fear, right? It's a public health pandemic, where people don't have access to clean water. I do wonder, though, about the possibility of changing that in the short term so that even when the restoration program doesn't maybe continue, you don't have these back debts that people have with the water department that could also lead to them losing water.
Yeah, I think that's something that we need to look at. I know that the main issue is, we have to figure out how to pay for any type of low-income water plan in the city of Detroit. And so we have to just be creative and innovative and find ways in which we can provide clean, safe water to low-income residents in Detroit. It's something that I know all of us are committed finding a solution on. But it's definitely a priority for me as we continue to move out of this crisis and possibly into a second wave of COVID-19.
Yeah. Okay. Well, Mary Sheffield, President Pro Tem of the Detroit City Council, was great.
Thank you.
Good to see that you're doing well. And
you as well.
Thanks very much.
Thank you so much for having me.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.